Hello everybody, welcome back. Today we'll be discussing the second topic in the 164 issue list posted on the anatomy department final exam of the University of Wroclaw, the medical university. So here we're gonna discuss the second point. The second point mentions or states the general features of the typical vertebra. So here, as I said in my vertebral column video, that when you see general features of a typical vertebra, we're talking about the individual bodies, not the column. Okay, so before we go into details, always remember to have a mental image. The mental image that we have to acquire in this answering process for this point specifically is a general image of the vertebra and how it looks like, its parts, what makes it up. From here, I, as Haytham, let's say I am asked this question, I put this image right here in my brain, and then I slowly and calmly give my answer to the person listening to me. So just before we discuss what the guide has here, we will just dive into very brief description of this vertebrae. For example, what I've seen in my mental image right now, which is this one, I see a body within the structure of it. I see the pedicle, which is the part that connects the body to the transverse process, which is right here. We have two of them. I see spinal process in the back. I see two transverse processes, and I see 2 articular processes superiorly, and then inferiorly 2 of them as well, 2 articular processes. And that's just the general image of what I will have in my brain for the vertebrae. And this is basically the basis or the strong foundation of a start of this answer. Because once you have all of that, you've basically mentioned the characteristics of the vertebrae. Now, the more specific details that we will dive into is how those structures of the vertebrae differ across the structure of the vertebral column in different regions. For example, how does the vertebrae look in the cervical region compared to the lumbar region, basically thoracic region? You know, like all of those things differ in those different regions according to the specific structures and functionalities of these different vertebrae when it comes to the general function of the vertebral column. So again, to begin this answer, we will always begin and stating the general facts, the introduction. For example, here, just say what the vertebrae contains in general. So it has a lot of structures. As I said, body, you see, it's right here, body. Okay, there's the after the body, they have this structure that contains all the structures that we mentioned, is the vertebral arch. So this right here is the vertebral arch, and everything that extends off of it are structures that make up the vertebrae. So mainly they are 2, body and vertebral arch. Okay, so body and this vertebral arch. So that's the general. Now we go into deeper. So the body in details, it's just a place where the IV discs are attached superiorly and inferiorly, where that's where exactly the vertebra articulate with each other because of that intervertebral disc. You can read more for your own information. It's written right there, but I want to move on because this topic is really huge and I just want to cover the important parts. Okay, so next we have the vertebral arch right here. We said pedicle, 1 on each side. So on each side there's a pedicle, as I said, extending from the body to the transverse process right here. Okay, so there's a transverse process, body. So these extend in this region. Sorry, you didn't see it. So yeah, so here, body, pedicles extending to the transverse processes. Okay. And they're labeled for you here, just from a different perspective. Next, we have the laminas. The laminas, they are right here, just between the spinal process and the transverse process. And if you see on this one right here, the laminas appear to be right there. So there are two laminas. So we have pedicles, laminas. Next, we have transverse process, and the transverse processes extend from the body, from the vertebral arch, sorry, right here, and there are two of them, and they're present everywhere in the vertebral column. Next, we have the spine, or the spinous process. It's the most posterior part of the vertebrae. At the meeting of the two laminas. Okay. Next, as I said, remember, I said that the each vertebrae have 4 articular processes, 2 superior and 2 inferior. This is a good image for you to see the perspective that I was speaking about. From the side view, we have the body, we have the pedicles, the transverse process, the spinal process here. This appears to be on a region of the vertebrae. I think this is the thoracic part. Well, I can be mistaken, but yeah, it seems to be the thoracic part. But just to let you guys know that every region of the vertebrae have different features, as I said, and have different shapes. Usually the thoracic spinal process is pointing downwards like that. Okay, so spinal process, transverse process, 2 superior articular processes, and 2 inferior articular processes. Okay, so these are the general features. Now, remember I said in the video of the vertebral column that the spinal cord is protected by the vertebral column and it passes through it. So where does this pass through? You see this part right here? This is called the vertebral foramen. Right there. So just to add to the most important features of the vertebrae, as I said, body, vertebral arch, with all of those things in the vertebral arch, and then you have the vertebral foramen. Vertebral foramen withholds the spinal cord and its coverings, meninges. Yes, so the spinal cord has some protective layers around it, and all of those things are found to pass through the vertebral column. And if you imagine, this is my pen passing through this vertebral foramina, passing out of the page and into the page along the length of the vertebrae, into the vertebral foramen, okay? These are some important things present there as well, like arteries and veins, routing out to supply the spinal cord and stuff like that. Also, fatty tissue is found present there, okay? Now, that's basically the overall structure of how you should go about answering this. Now you have covered the general information, but you have to also know details of how those structures right here differ in different regions of the vertebrae. So for example, in the cervical part, in the thoracic part, and in the lumbar part, okay? In the cervical part, we have to remind ourselves that there are 7 of them, okay? I would dive into first remembering the most important cervical vertebrae, the first 2, the atlas and the axis. Okay, the atlas and the axis, they are the first 2. And then I would remember C7, which is a prominence. Why we are mentioning only those parts of the cervical vertebra? Because they are the most important regions. They are the most important parts of the cervical region. Why? Is because they're kind of different and they deviate away from the main structure right here of the vertebrae. Like the atlas, the axis, and then the prominence. So just because we don't want to go into discussing every cervical vertebrae, there's C1 to C7. Imagine going to C1, then C2, then C3, C4, C5. Like it'll be a lot to mention for this answer. So just focus on C1, C2, knowing their important features right here, and then you go into C7, because if you touch on your neck, just at the top near where your shoulders start in the vertebral part, you will see that there's a prominence, and that's C7, and that's where the C7 happens. Okay, so I don't know if I should make a separate video discussing the atlas and the axes, because they do deviate away from the general structure of the vertebrae, because they form an important feature of the vertebral column, where the head articulates with those two and forms the joint between the spine and the head. And I think the first joint between the cervical and the head or the skull is called the Atlanto occipital joint, because the atlas articulates with the cervical with the occipital bone of the skull. And that's why you see that these regions of the atlas right here, they're articular surfaces, and these surfaces articulate with the occipital bone of the skull, and that's where the skull sits and rotates onto the atlas. And if you see that the vertebral foramen of the atlas is huge, why? Is because the dens of the axis, which is this part right here, pokes through it. So you will see that the axis dens pokes through it and goes out towards you, towards the screen. And that's how the atlas and axis and the occipital bone are found to articulate with each other. The dens here is poking the vertebral foramen of the atlas, and the atlas articulates with the inferior articular surfaces of the axis articulates with the inferior articular surfaces of the atlas, and so you see these parts right here. They are the superior articular surfaces, and they articulate with the inferior articular surfaces of the atlas. Okay, so there are more to be said about the atlas and axes and their general features. What you need to know is those specific details of axes and atlas, and I think our video will be very, very long if we go into discussing those details. So I advise you to go and study those, or I can just make another video about them. But yeah, the axes and the atlas, first two cervical vertebrae, we'll move on. Then the vertebral prominence here, C7, it has a very long spine, as we said here, long blunt. Okay, and these are the main characteristics of the cervical vertebrae. Next, we move on to the thoracic vertebrae, and it says here on page 4. So I just have to find page 4. Just give me a second. Right here. In general, just to let you guys know that you are expected to know and differentiate between the cervical, the lumbar, and the thoracic vertebrae characteristics. So how do we do this? I had to go through discussing important features of the general characteristics of the cervical, but then we didn't go through how each and every region differs when it comes to their different characteristics. And I how do I go about studying this is usually I will make a table like that. Cervical, thoracic, and lumbar. Okay, and then through the rows, I put all of the characteristics so that I see them in front of me and differentiate between them. So how do we go about this? For the thoracic, for example, the body, you guys have to know that is heart-shaped. This part right here shows kind of a heart-shaped. If we know that the heart is like that, this is kind of what is shown here. So that's what meant by a heart shape. The vertebral foramen is narrow. Okay. The transverse process is directed posterolaterally. So what do we mean here? So you guys have to know where and how the transverse processes are pointing. So in different vertebral regions, you are required to know the direction of pointing of those processes. And I don't want to go into details because it's a lot of things, but I just want to point out what you are required to know. And so a table that summarizes all of those features will make your life easier. So this is an important part that you guys have to point out to at the end of answering this question. And I advise if you need a good guide on those, this guide that we offer right here is kind of very good for you. And yeah, so just as I mentioned, the body, the vertebral foramina, the transverse processes, the superior and inferior articular processes, and how they point, and then the spinal process, whether it's long, sturdy, short, and it differs across the three regions. So just to cap on how you should answer this, yep, this right here. Okay, so first we go into the general characteristics, then we dive into the differences across the vertebrae on the characteristics that I mentioned right now. The body, the articular surfaces, the spinal process, the transverse process, and then the vertebral foramen. So all of those have to be memorized for the three regions, cervical, thoracic, and lumbar. And the table, as I said, is very useful. This guide has a very brief description here of some differences that you might need to know. So the cervical vertebra has a small body, a foramen transversarium. So what is meant here is that they have those foramina, okay, in the transverse process. So as I said, the transverse process are those, and they have transverse foramina. Okay. Next, we have the thoracic vertebra. It has a heart-shaped body. The lumbar vertebra has a large kidney-shaped body. So you see, small body, heart-shaped body, large kidney shaped body. So a table, as I said, table. In this part, just make a table with all of those characteristics, and they're summarized, I think, right here. Body, vertebral foramina, transverse foramina, superior articular facets, inferior articular facets, and the spine, and how they differentiate in those three regions. And once you've answered this and you've got it all in one place, you can go ahead and repeat this knowledge, because it's a lot to take in. But once you've got it in place, you can never go wrong with Professor Swirsky. And as I said, repetition is very important when it comes to anatomy. It is, for your information, it is well known that if you repeat something 17 times, it's meant to stick in your brain. So I advise you, when you're studying a point, make sure you go through all of the information necessary. Go through all of the guides that I'm providing and how you should go about putting together your answer. And then once you have that in place, you read this answer a couple of times, and then without looking, 17 times repetition. Once you know that you're good with this point, you move on. All right, this was Haytham here. I hope this was useful for you guys, and I'll see you guys in an upcoming video. Thank you.